We good to go? Yeah, he gave me a thumbs up.
Go ahead.
All right, welcome to the Beadle County Task Force. We're having a special session tonight to go over our coronavirus in our community. We have the medical community with us tonight, along with a representative from our school system. Our goal tonight is to update our community on the virus in our city and county and to move forward with our effort to control the outbreak in our area. This is not intended to close our city down. Now I'll ask each of our speakers to introduce themselves, and I'll start with Mr. Nebelsack.
Thank you, Mayor. I'm Terry Nebelsack, your Superintendent of Schools here in Huron.
Dr. Joe Carr, representing the Beadle County Emergency Management for the Testing Center and the Call Center.
Hello, I'm Eric Larson. I am the President and Chief Executive Officer at Huron Regional Medical Center.
Dr. Robert Holm, physician, Cheddar and Home Clinic.
Erin Scarborough, Laboratory Director at HRMC.
Amy Gergen, the Director of the Inpatient Services at the Huron Hospital.
So thank you, Mayor, for inviting us to this tonight. I wanted to take first position here in terms of kicking this off and express to the community how grateful we are to be a part of this solution. I think as we have gone through some iterations of this pandemic over the last 9 months, I think we've learned a lot as an organization, as a healthcare provider in your community. As most of you know, in March when this first started, we were trying to figure it out. And over the last few months, we've continued to mature our response to the pandemic and find ways to help serve our community. To that end, in terms of the efforts that we're giving to date, since about mid-September, our hospital has seen anywhere from 4 to 10 patients in the hospital that are suffering from COVID. At one point in time, we had scaled back our elective surgeries. We have since been able to bring those back online. However, that's created some challenges in and of itself, which create some balancing that we have to do from an internal staff perspective, while still trying to maintain the safety and stability of our COVID response. And you'll hear later on from a couple of our staff members, Amy and Aaron, on what we've done more specifically. But as we've tried to balance that effort, I think it's become more and more prevalent in how we respond as an organization to the pandemic, not just as a community. I have asked our team to wear masks and have a mandatory masking policy within our facility so that we are ensuring that we are taking care of not only our social responsibility, but ensuring that we are taking care of our patients the best we can. And so, in essence, you know, this virus is not a respecter of persons. It does not care how much money you make. It does not care where you work. It does not care what faith you belong to. It is very much an agnostic virus that can affect anyone at any time. And so our responsibility as an organization is to lead out in setting the example in the community of wearing a mask, social distancing, and washing our hands. And whatever we can do in that regard as an organization to support that effort, we will do. You will see over the course of the next probably few weeks us joining with a number of entities here in the state for the Mask Up South Dakota initiative. We strongly believe that masking is an answer to that. We want to be able to keep our community open, but we also know that we have a responsibility to ourselves. And it's not about us as individuals, it's about us as a community. The perception that we're taking away rights or whatnot with mandating or asking our employees to wear masks is not about protecting them as much as it is about protecting you and others. So it's really an outward-facing expression of our deep concern and care for our community and our members and how well we take care of them. And so as part of a community solution, a community asset, this hospital is absolutely committed to providing the best care that we can and want to be an example of that in our community. And by wearing masks, social distancing, and washing our hands, even in our public interactions, we believe that that's at least a first step that maybe others can align to as well. So with that, I will turn some time over to our Director of Inpatient Services, Amy Gergen.
Thank you, Eric. I'd like to visit with you just a little bit about what's going on inside of our hospital walls. As Eric said, our influx has been since the middle of September, this surge. We have had steadily 4 to 10 patients within our facility in the inpatient departments. Our staff are getting tired. Community is getting tired. So we have asked our healthcare workers to come in extra, to work extra hours, even on their days off when they should be recuperating and taking that time with their family, mentally and physically taking time off. But they are digging deep and realizing that they're a healthcare provider and this is what they signed up for. We continue to keep our COVID patients separate from all of our other patients. We continue to have great supplies for our protective, equipment that they wear. They're staying safe and they're keeping all of our patients safe. They are also keeping our patients that come in for other illnesses. We still have to deliver babies. We still have to keep everybody safe. So we are continuing to change up and improve and make different suggestions, whatever we learn. As Eric talked about as well, we have to be flexible. We're learning from everybody else as well as other facilities learning from us and what we're doing to make things better. One thing that we just want to ask is we're not asking you to stop living your lives. We still want you to be present. We still want you to be available for others. Wear your masks, hand washing, try to social distance as much as you can. We will continue to do that within our facility and in our community to take care of all of you as well. Thank you.
So I want to touch base on what some of our other team members have stated about our influx in positive patients within the hospital and within the community. There's a great strain on our supplies for reagents so that we can test you properly. I know that I've worked very hard, our team's worked very hard at being able to maintain our supply chain, but nationally we're suffering, and now Huron's suffering. We do have things coming down the pipeline, but things come slowly, and with the increase in COVID cases, we can't get to everybody the way that we would like to. So what we're asking is to help mitigate that increase by masking and social distancing and hand washing and all the things that are important for our community to be able to function. Help us so that we can help you get the treatment and the testing that you need and you deserve, because we're all in this together.
Dr. Home, Cheddar Home Clinic, recently recovered from COVID, which was quite an experience. Never had an event like that in my life. But I am back and I am getting better and a survivor, so to speak. The reason I'm here today is to give a little comparison to where we started and where we're at today. The initial 3 months of COVID was a multitude of guesses at how best to treat, how best to prevent, but ultimately ended up being a lockdown, which ultimately blunted the curve, brought the curve down. And through the next several months, worldwide experience with different modalities for treatment has significantly decreased mortality, decreased the length of illness that we experienced within that first 6 months. We've come a long ways. We understand a lot more about the disease process. Patients are much more aware and much more likely to call sooner than later in many instances, time frame is very important. The nature of the disease is so variable, but the bad outcome cases are normally patients who develop significant dyspnea, shortness of breath, significant cough, and respiratory symptoms. We've changed the approach over the last 4 months to include a myriad of medications, but inhalers that is very tantamount to helping combat the filling of fluid in the lungs and the incessant cough, and then ultimately the respiratory failure, which carries a very, very high mortality. There's no question that shutting down the United States stopped the initial surge, but at some point the world has to pick up and go again. But it cannot pick up and go again as it did before the original onset of COVID. Precautions that we're asking to implement universally with masking, hand washing, social distancing, and avoiding large crowds is the most important thing that we can ask our patients, our community, to do for themselves and for their fellow members of the community. There's no question that the combination of masking, distancing, hand washing slows the spread, and the spread can take our healthcare system and basically render it unoperable. If the numbers of people increase to the extent that we can no longer care for hospitalized or patients requiring hospitalizations for COVID, the rest of South Dakota, hospitals smaller and bigger, are even more in trouble. We as individuals within our community have to do everything that we can do to blunt this spike and control this. The long-term treatment for this combination of newer medication, which is probably months away for the nation, but the vaccine, for the mass is probably 2 to 4 months, and we have to get from here to there. So for now, everything that we can do to slow that spread is tantamount to protecting our community going forward. Thank you.
Good evening. I'm here on behalf of the school system, and just want to share that with the guidance of the Operations Task Force, which our school board entrusted to guide the superintendent and the district on what we do. We are at about the 9-week point, or a fourth of the way through the school year, with some incredible successes. That it's my goal that by sharing them, perhaps the community can embrace some of them as well. We have protocols in place for hand washing, for masking, for shields when people can't be socially distanced. We pay attention to socially distancing, and then we time interactions if we have to be together, even with masks on, to make sure that we do not violate the time where the virus surge would be too heavy. The reason I share that is because 3,200 of our 18,000 plus people in the county gather in 5 school buildings. 17.7% of the county population gathers in 5 school buildings for 8 hours a day, 5 days a week. And yet we still have data that shows that less than 1% of the people that have been identified as close contacts because of someone outside the school have wound up testing positive for the virus. Less than 1% of the student body. Most of the cases that we get are from family or family gatherings or families gatherings in organizations, reunions, churches, etc. But even when they come to school and we get the calls from the Department of Health that they've tested positive, we cannot trace a verified case where it has been passed in school. I've got 2 cases out of a couple of hundred that people believe it was passed in school. However, there have not been a positive person around those particular people. Because of that, we think that we are part of the solution, that if we can have the kids with us in a healthy school initiative and keep the spread to under 1%, perhaps we can be part of the solution. I can go on with a little bit more as a longtime citizen of the community, but I would just ask each of us to ask, what could we do in this effort to save all of us in the long run? And I think that the work of the task force watching the school data and making decisions based on that data is something that we can perhaps expand to the community.
Okay, so I'll wrap up our statements, and then we'll have the mayor, and then we'll do question and answers. So I'll just kind of start from the beginning. Huron and Beadle County, we've been in this pandemic fight since the beginning that it hit our nation. Unfortunately, we've had a mini surge, a larger surge, and now the biggest surge we've had. So I get that everybody is getting tired. We are finally gotten to the point that the hospital system is getting more stressed. Our original goal when we set up our task force, as far as our testing center and call center, was to build a perimeter around the hospital so we could only have them focus on people that were sick. And really the first 2 times, we did pretty good with that. There weren't a lot of sick people with COVID in the hospital. But this go-around has changed. This go-around has made the hospital and our medical community extremely busy with COVID patients. So we want to try to keep that perimeter going, but we're asking you guys now to help us out more by the 3 things we've all talked about. Wear the mask. Make the mask your lifestyle. A common theme that I followed different states, I followed different professionals, and when they interview their patients with the COVID, they all say the same thing. I wear masks, but it's not all the time. I social distance, but it's not all the time, and then they're ending up in the ICU. So if we make it our lifestyle to wear a mask, to social distance, and to wash and sanitize, the studies show, I just read an article today, that by 40% in 1 to 2 weeks, you're going to start reducing the curve of the amount of infections. So that would be a huge thing if we all just bought into the fact we have to protect each other and do those principles. So currently at the testing center, as Aaron said, we can no longer do the quick test at the hospital. So the 2 options we have for all our school children and the faculty of the school, we have a new rapid kit, which is if you're similar to doing like a strep test. We do the swab, we put in a little kit, and 20 minutes later we're able to read if they're positive or negative. Those tests are available only to people associated with the school and only to you if you have symptoms. If you're asymptomatic, those tests are not what we're doing. Again, our Abbott tests we're doing at the hospital, we currently cannot do that now. So we're sending all of our tests to the Department of Health, and our turnaround time now is a little bit slower. It's 1 to 3 days. The last couple days, I think we've been getting them back in 24 hours. So we are still getting a quick turnaround, but realize the rest of the state is having to follow that same process. So we have to be patient on the testing. At the call center, they're extremely busy. I just asked that all of us call in with your questions, call in with your concerns, call in if you need to be tested, but be very patient with them and be very respectful. It's a very stressful job they're doing, and we have to realize that they have multiple things. One, they're trying to set up when you can be tested or try to coordinate your care with the hospital and medical providers. They're also going to return your calls quick as they can on whether you're positive or negative and give you instructions and recommendations on that. One of our other goals we've been doing since day one is trying to call people that are sick, whether they're positive with COVID or whether they're negative, to continue to monitor them and to make sure they're getting the advice they need and when maybe to call the hospital or call their doctor. We're also now going to do more contact tracing. The state has contracted with our Beadle County call center to do the contact tracing and the calling for Beadle County, Han County, Spink and Sanborn counties, Gerald and Kingsbury. So we're going to get a better feel on what's going on in our region that the hospital serves and our medical community serves. So we just ask that when they contact you, be very honest with the questions they ask, and also if you get tested, knowing now it's going to take maybe 1 to 3 days to get your results back, that you stay home and stay quarantined while you're waiting for the results. We can't test and then go about our regular business thinking that we could be positive and being a spreader of the virus. So a lot of people have asked the call center, why are we getting such a surge? And I think we've all talked about that. What I'll end up right now is in the summer, we were able to shut down, like Dr. Bob said. We all took it serious. We shut down. We weren't having funerals, weddings, birthday parties, you name it. As the summer started going along and the fall hit, we've all gotten back to the weddings, the unfortunate funerals, the birthday parties, those social gatherings. And we're not saying do not do them, but again, if we would wear our mask, if we would social distance while we're at those events, and if we would wash and sanitize, we would significantly reduce the spread of the virus, and we can get back ahead of this. So that's the big thing we're all asking tonight. And with that, I'll give it back to the mayor, and we can open up for questions.
Thank you, Joe. I believe we have some questions. Barry, would you
Yes,
like to
we do.
read them?
The first question is from a person from Huron to Eric,
Yes.
our hospital administrator. If the whole point of lowering the curve was to get ready for the eventual surge where the hospitals would be overwhelmed without preparing, then what has been done to prepare for that? The virus isn't going away, so what was the point of it all? He continues, thank you for answering the question. But if you haven't prepared for the surge, then what are you doing now that you should have already done?
So great question, thank you. So we have, back in March, we met together as an incident command within the hospital, and we started to put together and have put together a surge plan ourselves. So we have done a lot of legwork back in March, where we implemented different surge levels based on a number of criteria. That surge level is managed by and large by our nursing supervisors that says, how many patients do we have in-house, what is our PPE, and how much staffing do we have to manage COVID patients. And so we did a lot of surge planning. We did a number of tabletop exercises as well, not only with the staff, but with the medical staff, the physicians, and even with some other healthcare partners in the region to manage if we had a surge, what we would do with them. What we're finding now is that those plans continue to be tweaked and adjusted, and so we continue to, in some sense, react, because now what we're seeing is more of a statewide spread, which is impacting some of those community or other partners' systems. And so we have to manage that as well and say, well, can we realistically transfer this patient out to, say, Sioux Falls, for example, and ask them and call them and ask them if they have a bed. Sometimes they don't because they're overwhelmed as well. In the hospital itself, we've done a number of things. We talked about this, I think, at one of the earlier meetings with Amy and Pam and Aaron, where we've put up barriers and whatnot within the hospital to segregate out the COVID and the non-COVID patients. We continue to practice that today with how we treat our patients. And so we've done a lot of infrastructure changes within the hospital to account for that. And a lot of that was put in place when the COVID census was low, and we're utilizing that today. So we've done a lot of preparation and a lot of work. One of the things that we're seeing today is really that community spread has started to impact our staffing. And so we're seeing some of our staff come down with it, not because of the work they're doing in the hospital, but more because most likely other things that are going on in the community. I would stand behind the hospital being the cleanest place probably in this community that a person could be because of the precautions that we take, whether it's PPE or 15-minute cleaning rounds or masking, that it is very unlikely that somebody would get contact COVID by being in the hospital or even working in the hospital. So we're starting to see some of the staffing challenges that we did not see early on because of some of the controls we're putting in place. Then we're starting to see some of that because of the external influences that are happening to our staff at this point.
I'd like to add something to that. By middle of March, the medical staff, all major department heads, administration, were meeting twice a week. And we did so for the first 6, 7, 8 weeks, going through everything that we could do and have done. Other nuances that have been brought in from outside information. We have worked our tails off starting in March. So there was no delay or whoops or we should have or so that's known.
You know, one thing I'll add with that, Dr. Bob, you were spot on. From day one, I think it was 3 times a week we started out, we had a meeting 3 times a week for an hour with the Department of Health. And literally, they were looking at what Huron was doing successfully to fight this. Huron's been in that game, and they've been an excellent player in this game. It's just that's how overwhelming it is. There's no way to prepare for the amount of people that are sick and the needs they have. That, again, is why we're asking us to step up and try to reduce that, because we have done more, I shouldn't say more, but the state has looked to us for leadership on a lot of the issues that have come up in the state because Huron was in the game right away and did such a good job preparing for this. So I think we should commend our task force, our whole community, and certainly our hospital for the work they've done.
Any other question, Barry?
Yes. We have another question. This is probably again directed towards Eric. How many staffed hospital beds and staffed ICU beds does HRMC have?
So I should kick that to Amy, actually. She would be a great one to answer that question.
I sure will. ICU beds right now, we currently have 6 ICU beds in our rural critical access hospital. We do have 9 actual negative pressure COVID rooms, but we can double some of those rooms, so we can have up to 14 right now currently. But again, as we've all talked, we tweak as we go. So if we need to move that forward and open that up farther, we certainly can. But you did use the word staffed beds. That is a big word right there. So that is a daily struggle. That is a daily conversation, and we will continue to work with our staff and with the amount of patients that we have.
Thank you. Another question, Barry?
Yes. Today, and this is kind of open if somebody can answer this one, so this is a little trickier. Today's numbers on South Dakota Department of Health site, it appears that out of 32 tests processed, 30 were positive. Can someone please confirm?
I can take that. So the problem with the actual numbers that are displayed is the time in which they're displayed. I can say from our lab point, when we were processing 20, 30, 40 a day, we don't reach the state's cutoff. So they require us to report everything by noon. We can't process that many by that time. So a lot of that is a lag time. And again, there's all these different entities that are reporting for Beadle County. Just because the hospital tests for Beadle County and the collection site tests for Beadle County and Han County, whatever, that doesn't necessarily encompass all of the people that are tested for our region. People go to Sanford, people go to Avera. You could be tested in Nebraska. It all goes back to the county in which you live. So all these different tests are becoming positive or negative at different times. So the influx in numbers isn't always the most accurate for that day.
And another thing I want to add, Aaron, I just sent Sam a text at the call center to see if he can answer it, but we've been tracking our percent positives with at the testing center, and then we'll routinely talk to, whether it be quick care, whether it be the hospital emergency room, and our percent positive rates have come back anywhere from 25% of the tests we do being positive to 60. We've had some days where there's 60% of the tests we do positive. And just at the testing center, we're probably averaging now between 25 to 40, sometimes more tests a day. That's just in one center, where there are other clinics in town that are also testing. The call center just texted back and it said, we're maintaining right about 50% positive rate right now. This article I read today, that statewide it was at 40% positive rate on the tests. And the goal that the nation wants is 5% positive rate on your test. So the moral of the whole story is we're pretty much just testing people that are sick, and people that are sick, almost half of them are coming back positive for COVID. That's a scary statistic.
And then the follow-up question from the same individual was, are there any plans for overflow at this time?
So as part of our surge planning that we have done in previous months, we have a surge plan that we can hold over 38 patients if we had 38 positive patients in-house. That requires a lot of juggling, of course, and it's not necessarily the number of beds available for COVID positive patients. What the limiter really is staffing. We can put people almost anywhere. We just don't have the people to take care of them. And so that's really our rate limiter. It's not PPE, it's not where to put them, it's how many people do we have to take care of them. And that's why it's so important that we, as Joe has said, try to put this ring around the hospital to protect those staff that are taking care of patients, because if they start to get sick, that dips into the number of people we have available to take care of patients too.
See, again, not that I'm jumping in, but we've talked about that months and months with our task force meetings on a COVID center or whatever, to put these people in there that we're either monitoring or we're observing. But it always comes back to the fact that if we do that, we're going to need medical equipment and people that know how to run it. So it's not as simple as put up a tent or do the arena, some things we've thought of. We need the staffing, and that's what's literally, you have to have that hospital setting or direct right access, or we're doing those people a disservice by putting them somewhere where they cannot get the help they need.
One thing I'd like to add off of to Joe as well is we are starting to see difficulty in some of our nursing home placement patients. And again, as we talked about transfers, pending on what the other facilities have going on with their bed availability. So we are constantly looking at our staffing plan and our surge plan, because we may have patients that are ready to be discharged and we don't have available places to send them. So.
Okay, the next question. Will there be any mandates given to the community regarding the wearing of masks or the amount of customers within the various businesses throughout the community?
Anybody want that one?
I think that's why you're like.
We had quite a discussion on our last meeting on Monday night for over an hour about masking and what we're going to ask of the community. And it came out of that meeting that we weren't ready to do anything mandatory. We would like to have our community and our employers and our businesses to step up and show some responsibility as far as what we're asking for masking. I thought the issue that masking up in, say, South Dakota, I reviewed that on TV last night. I think that's a great step forward. I think that's what we should be asking people to do, asking our businesses to do. We're all responsible for this. We got to get it done. But the answer is specifically, no, we're not ready to close down or issue a mandatory masking at this time. that's not off the table. We don't take tools and off our table, but that's not off our table. So with that, I hope that answers that question, Mary.
Okay. Okay, another question for Superintendent Nebelsick. The person is curious as to why other cities announce the number of students and teachers that are positive in the newspaper or on school websites, but Huron District does not.
There hasn't been a huge call for that, because what we've tried to do is follow the protocol that if there is a positive in a classroom, then all of the parents who have a child in that classroom are notified that there could have been a possible exposure. And then, once that happens in a classroom, any student that was in that building, their parents, through the communications that are set up by that school, are notified that there could have been an exposure in that building. And so by following that, and the fact that we have so very, very few that are positive, we just have, that's the first time I've been asked that, because our relationship's been with the parents, and the communication I've got with the parents is that they've been appreciative of knowing when there had been a close contact. And then it's not asked, but the second part, just to try to reassure a community that we all care about, is that we continue to follow the data to see that once we had notified that, had there been anyone else in that classroom that eventually got sick, and there has not been. So the protocols are working, and we're notifying the parents. I could look up that number if someone wants to call me. I would not have access to it tonight, but it's very, very limited when you look at the number of students. Most of what we deal with is families become ill, and then we have to watch their children to see if they become ill. And again, the percentage that are becoming ill of the young people is right at 1%.
Again, this probably comes back to the lab. Do we have the adequate tests to maintain our testing levels?
So that's the loaded question, obviously. That depends every day on how people protect themselves or don't protect themselves. We always have enough supplies to have testing one way or another. That doesn't necessarily mean that testing will stem through the hospital, though.
So to reiterate, and Aaron said right, we have not run into a situation yet where if you're sick, you can't get tested. Originally, when we first started, we had to wait days before we could test them. Now, if you're sick, we have enough capability to test you. Multiple different areas, multiple different return times. Where we're in trouble right now is if you're asymptomatic and have been exposed, which the guidelines do say direct contacts should be tested. We have come to believe it's within 5 to 6 days is the best results, but we can't test those right now. We do not have the capability to
Let me
test
clarify
those.
that just a little bit. We can test them. We refer them to our reference lab. We cannot test them in-house or with the state. So there are methods out there for you to be tested. It just is not a fast turnaround time as people are wanting.
I'd like to share just a little bit on the testing supply, that if I was a member of the community, I think I would be of interest to this. We received an announcement, a joint announcement from the Department of Education and the Department of Health about a week and a half ago that they were going to provide what is called a rapid test for schools to use in order to determine in a short amount of time whether a student or a staff member had been ill. And because of the concentration of young people and adults that support them in a school setting. The first rules that came out on that a couple weeks ago now said that schools had the choice of either using those tests or giving them back to the state, and the state would try to get them to somewhere in the general community where they lived. And I'm very, very happy to be able to report that when we described the relationship that we have with the Operations Task Force and the Test Center, and we described that we would be better off to share those resources with that task force and that test center than to have sick children coming into the school in order to be tested, which would add to a contamination issue. There was an evaluation that took place at the state, and they came out with a new set of rules that were really based on our protocol. The reason why that's significant, all of the area schools now have furnished a portion of their product that they receive. For instance, we received 545, and it's projected that we can receive 2,800. We allocated a proportion of that, and every surrounding school district did, to the test center, thus eliminating what is 17% of the county population does not have to use the other testing units. And so we think that that makes us a part of the stewardship of causing all of this to be successful. Now, the test center had to covenant with the state that they will participate in reporting on the website, so the state has the direct access as to what's happened with each of those tests with the children and the students. But if you all of a sudden take all of the schools in the area participated with our test center, we hope that that helped the other tests be available for the other 83% of the population.
And if I might just add to that too real quickly, if you look at the root cause of test result availability, you obviously can see throughout the nation and even our state the influx of the COVID spread. And so that's created supply chain issues with getting reagents that allow us to do that, resulting in-house. So until that really solves itself across the state and the nation, we're going to continue to have supply chain issues with getting the reagent that will allow us to result that at HRMC. As Aaron said, that doesn't prevent anybody from coming and getting collected. We will just have to send that to the state or to Sanford or to Nevada to be able to be resulted, but cannot be done in-house until that root cause is solved.
Okay, Terry, this is kind of a blend of two questions, really revolving around your in-house protocols. How the schools and the hospitals say that none of the positive cases came from either place. They don't seem to be consistent. And then there's a follow-up that says, I don't understand, and this really blends together, they don't understand how kids in a class with a teacher who may have been exposed or test positive are called no close contact, yet they're in school all day with said teacher, and that would normally be considered close contact. And so can you talk about those protocols?
Yes, I can. These are the protocols, and each time that the Department of Health calls, in fact, I usually get calls in the evening, so I thought I might have to step out, but the good news is we've had no Department of Health calls in the last 45 minutes. But the protocols of hand washing, the protocols of masking, the protocols of shields around, we believe now we're at 75% of the desks have shields around them. The eating centers that are the closest sitting together at the elementaries are all shields between each eating center. We social distance in the classroom, and then because we have staff that come back in who, for instance, this week, someone let me know they tested positive because they contracted it at a family gathering. Another one felt they had contracted it at a church gathering. But anyway, I said the word contract. They had been exposed. They had not contracted, but they'd been exposed. So then we use the critical infrastructure law that allows those staff members, if they choose to continue to work, and we monitor them. If they get any one symptom, they are out of there. The short answer, after I rambled, and I apologize for that part of my personality, the short answer is that These 5 protocols have shown that we have not had community spread, and that less than 1% of those who've been identified through either the call center or the Department of Health as a close contact have ever become sick. So that data, the nurses share that data with me on a daily basis, and then the nurses share it with the task force weekly on our Zoom calls. So they're monitoring, are the numbers staying down?
Can I jump in on that real quick? I think to reiterate Terry's point with this is the shielding and the masking that's going on at the schools is going on in the hospital, and that's why we're mitigating our spread. There was one conversation that Joe and I had with Dusty Johnson where we could state that everybody who worked at the collection site takes all these proper procedures and all these proper protocols, and not one of us has ever become sick with it because we follow these mandates. That's why we're asking you to follow these mandates, because they work.
Yeah, and I was just gonna say the same thing, Aaron. Our numbers, they're probably approaching 3,500 tests we've done, and I've done a lot of them. And
I would say we're well over
Yeah.
3,500,
we're
yeah.
probably close to 4,000. If everybody knows my person, I'm talking that, I'm Italian and I'm in your face. So I've been this close to a lot of people with COVID, and with all my protection, knock on wood, I have not been sick, and I pray to God I don't get sick. But I'm here to tell you, mask, social distance, wash, and we're gonna save a lot of people.
Okay, I have a couple more questions. These two both came in from the internet, or from the email. Superintendent Nebelsick, you're a popular guy. With the community now at the highest active number that it's ever experienced, parents are having to make decisions on keeping their children home. CDC guidance is that if a parent cannot isolate while a child is home, the child should quarantine until 2 weeks after the parent's active period of the virus is over, which would mean as much as 25 days at home. However, the new Healthy Student Initiative put forth by the school district would have the student immediately back in school. While information has been passed along incorrectly by some school staff that children can return even while parents are inactive, or while parents are active with the virus, clarification from other school staff has said that the new policy intends for a child to return immediately once the parent is clear of active virus. The question is going against CDC guidelines wise for the community? Does it set the school up for potential lawsuit if transmission were to occur at school that would lead to a fatality?
It's a fair question, and it's one that keeps me up at night. It's been weeks and weeks of this with meetings since March 13th, and I'm going to try to answer several parts of that. The first one I'm going to answer will add consternation, but transparency is really important. We are not differentiating between whether parents are sick or not sick at home. If a child does not have symptoms, and we follow all of the protocols, we are monitoring those children and allowing them in school. So the part where they heard from staff members that they could be in school right away, when this goes in place Monday, that is true. And if any child gets one symptom plus close contact equals 10 days out. We're making the assumption that the isolation has to happen immediately. We believe that with 9 weeks of data, that all of the things that we have in place are offering protection so they're not spreading it, and by detecting with their first symptom to get them out of there, we believe that the losses to children for the hundreds and hundreds of days that you're out, because if you do the math with those that are out 24 days and those that are out 28 days because they were out 14 days and then someone else in the family got sick and they were out another 14 days, we're talking about months of missing school. I can tell you, but of course I can't give you the details, to the mental health issues of isolation and being ostracized as someone who has been treated like they have the plague. That's a big deal with children. I can tell you stories about broken hearts where children cried and cried and cried, and now we won't even tell a child that they've been a close contact until we can get a parent there to support them, because it's that devastating to a young child or to an adolescent. I can tell you that the financial pain on parents to choose between going to work or staying home with an isolated child is a major heartache. I can tell you that this is a huge statistic. The percentage of our children in distance learning that have tested positive is higher than the percentage of children that attend school every day. So the task force worked on this for several weeks and kept saying, collect more data and collect more data. And when we put all of those things together, as some advice to me has been, Terry, you could be subjected to a lawsuit for ignoring the mental health issues of a child. You could be subjected to a lawsuit for malpractice and not teaching children because they're home, and you could be in trouble for having children at home without supervision, and they're healthy, but you won't allow them to come, and their parents have to work. And so I don't like any of this. I think it's aging everyone who's involved in participating in the solutions. But with a clear conscience, I can tell you that we believe that there will not be spread in schools if we detect the first symptom and all 5 protocols are in place. The 6th protocol, which we haven't talked about, is we have now shielded our buses. We have shields between the rows of buses, and we believe, based on our research this last week, that we're the only school district that's done that. So we're not advocating people come to school and get sick. We're advocating that with our protocols, we can give the children the best chance at normalcy, at a healthy outlook, and actually allow their families to heal. So yes, there's some risk, and I hope that the task force people that are on here will let you know how hard they made us work to get to this point. But they also have a pledge that the minute the nurses see that the data is changing, we will backtrack immediately if we're not a better part of the solution. And I would welcome the task force members to hold me accountable for what I've shared.
So I'll add just from what, let's talk the call center first. So when the state or our call center calls to inform, let's say Gary, that he is a close contact, they are going to give you the CDC and the South Dakota Department of Health guidelines saying it is recommended you quarantine for 14 days. So when we started this project to see, okay, what do we feel is a comfortable pilot project or get these kids that are asymptomatic back into school. So I called the medical providers, the hospital, and Dr. Bob probably gave one of the best recommendations. He said, look and see what the American Academy of Pediatricians has to say. And on their website, they pretty much cite what the CDC says, but they also cite the strain that it is on children and families. And that and the CDC say, but each school district may have a different policy, and that is up to local level and local control. So they're even saying each district can look at what they feel is best. The biggest thing I can say about our school district is 2 things. One, our district in Huron has done more than any district, I'm probably going to say nationwide, on protecting our children. With the way we've gone through all those stages, the masks, the screens, trying to, in a big district, social distance, doing the buses, everything we've possibly done to protect has been more than any other district in the state. The second thing is the data that the nurses are going to follow is going to be extremely closely watched, and if that data starts going the wrong direction, it is back to certainly 14 days and maybe start going, smaller steps from there. So it's a very serious question. The Department of Health and the Beadle County management will tell you what the CDC says, and then you will have the option. The school is allowing this very well monitored solution to getting your children back, and we're going to very closely watch that.
And I think from a philosophical standpoint, I think Terry and his team, and everybody here is obviously trying to do the right thing for the community and the students. I think at the end of the day, it becomes a choice, and you have the ability to choose. Nobody is taking that from you. But know that these are the best intentions for continuing to have our community be, to thrive, that our education system is maintained, and that our children are given the care and need that they, for their education. But at the end of the day, it is all about choice. There is no way that anybody can force you to align one way or the other. It's a personal choice, as is wearing a mask, washing your hands, and social distancing. That is a choice. We just plead with you that you make the choice to look out for others, to do the right thing for other people too.
Mr. Nettle, some schools in other states are not going back to school after Thanksgiving to 2 weeks after Christmas. Is that something that Huron is considering?
I strongly support staying as normal as possible. To leave the realm of school superintendent for a minute and be a member of the community. As I've watched all of this, I'm a strong supporter of masking all the time and having as many things open as possible so that life and vitality and children can grow and learn and play. And so unless the data would show us that there is a breach in the school, it's my opinion that if we were not in session, there would be an escalation of cases of sick children in our community because they're not going to lock down anymore, and they would be exposed in their social settings, etc., without any of the protocols that we have in place. We have a lot of parents right now that have bonded with their kids that their social interaction is in school, where it's supervised and where the masks are on and where the shields are in place, and then they're basically home the rest of the time. And so I believe the best chance for the children of this district and my grandchildren in other districts is to maintain as much normalcy as possible and follow every protocol that the medical profession teaches us.
And to carry off of that, as a mother of 5 and an essential worker at a hospital, by not having our children in school, that puts a strain back on us at the facility. We have several people who are single parents. They cannot be at home taking care of their children at home because they have to distance learn without foregoing their job. So there has to be some kind of happy medium, and as long as the data proves that our children are safer in school, that's where we need to stand.
Okay, as a follow-up, none of this addresses asymptomatic spread in schools or in the community. I personally know people who had no symptoms but were positive. Isn't asymptomatic spread as big a part of this? Is that as big a part of the spread?
You know, I'll answer that real quick, and then Terry might have something. You're 100% correct. That's why we're saying mask, social distance, wash, because we don't know who is sick or who is not. The more we can protect each other, again, in the schools, we have everything set up there that's the best we can to protect. So we ask you to do that outside of school. And the hospital, we ask you that outside the hospital. When you come into my clinic, we ask you that outside the clinic. So those asymptomatic spreaders, we can cut that down by 50% or more if we do the mask, wash, and social distance.
And real quickly, Terry, when you come through, how will winter sports be handled with, and has the spread happened within the sports and competitions?
Thank you. We had wow, that's a lot for me to keep track of, so get me back to the sports thing in a moment, okay? The asymptomatic, I think, has been real since August 24th. I shared with the 400 faculty at our first address, and then I shared it on a video with the children that we need to each assume that we are a healthy carrier. And if every one of us assumes we're a healthy carrier and does everything we can to not give it to someone else, we can keep it out of the schools. In my own office, since March 13th, I do not walk out of my office to the secretary's office without putting a mask on. The admin assistant does not come into my office without putting a mask on. and we have a staff that assumes we are asymptomatic carriers. So when that person asks, are there asymptomatic carriers, I believe yes, there are. And if all of us in this community would assume that we're a healthy carrier and therefore we must mask to protect each other, it would work. So yes, 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 I think there's healthy carriers every place. On the sports thing, we had an early scare, and I really don't like being the media star, even though sometimes it seems to find me, but we had a football player become ill. This is way back in August. He was tested at the beginning of football practice for temperature and symptoms, and he was fine. Became ill during that practice and went and got tested, and then it was notified to me. I closed the whole football program for 24 hours so we could catch our breath and learn early how we were going to handle this. I was blessed that the Sioux Falls School Superintendent, the Director of Medical Services for Sioux Falls Schools, and the Activities Director at Sioux Falls, Washington, I was able to consult with all of them because Washington had had a student the week before. And what they got into my heads were protocol, protocol, protocol. You're going to have sick kids because of things that happen outside, but your protocols will stop it from spreading inside the sports. And so we have had probably, I hope I'm not off very many, but in this many months, I'm going to say we've had 6 to 8 student athletes across our different sports that have tested positive and have had to been out for the full isolation. We've had a few that have been a close contact because of family outside that have had to miss events, okay? But we've had 0 that have been a close contact inside because of protocol, and that's why we haven't had any cancellation of games, because we've been able to continue to report to the Department of Health that our protocols are in place, and so even when a child in sports has gotten ill, the protocols have kept that from spreading. Was there any part of your question that I dodged? Okay.
Mayor, this one comes to you. Will the city and county staffs be wearing masks at work?
Well, I can't really speak for the county, but I think they are now. I know they have a protocol at their doors, but I think they offer the public to wear masks to go in, and I think their staff is. Our staff isn't as of yet. They have the opportunity. Anybody can wear a mask if they want to. We have all of our facilities, all of our offices have that the public gets to has plexiglass, so it separates our people from the public. But it's something we're looking at. We just spent a whole bunch of money putting in a glass window where people come in from the public and pay their utility bills. That's something just was an open window before. Now it's sealed up shut. Nobody can. Nothing can get through to it. It's just like a bank teller. You put your thing in, they pull the money back to you. So we're making precautions that way. We are looking at whether they're going to wear them full time when they work. We have problems with some of our workers because they're in the trench, digging a trench or something. They don't feel that wearing a mask in that setting. Or if they're driving a grader or something all by themselves, they don't figure they should be wearing a mask at that setting. And so we've got to work through some of those areas because we'll be involved in all those work situations through the winter. So we're going to have to work on it somehow. But as of now, we don't have a mandatory for the city employees, no.
As a follow-up to that, does the task force believe that mask wearing will increase without a mandate? Many places you go in Huron, few people wear masks.
That's probably the biggest reason we're having this, is because no one really wants to mandate it. But I will tell you this, that from the task force point of view and my stance on it, if we don't get better results, I'm going to push very hard to mandate it. That's what we're pleading with people. We all don't like mandates. No one likes, apparently in South Dakota, for anybody to tell you what to do. They don't want Big Brother telling you what to do. So for the the good of your fellow citizens, just wear a mask. You can do every other freedom you want. Just put a mask on. Social distance and wash. It shouldn't have to be mandated to help. But if it doesn't help, then I'm telling you right now from the task force, I will probably start pushing to get it mandated.
I know that in Brookings, they have a mandatory mask down there. As if you go into a building, they just re-upped it again for another 60 days last night. I listened to their presentation by their city commission. They did have one person come speak. They had two people, actually. They had a minister come speak in favor of extending it. Another guy came and had statistics showing that what their caseload was when they started their mask on September 8th and what it is today, and it's gone up substantially. And he's saying, what's your point of having a mandatory mask if we aren't going to keep this down? And so that's where we're at. That's a statistic that we're going by now. That's the only city in the state that has it. And so we're looking at their statistics, look at their growth, and see how that's helping. And right now, it hasn't helped. Now, it may in the next 60 days. They upped it again last night, so we'll see how that works out. I meet once or twice a month with all the large mayors, city mayors in the state of South Dakota, and there's none of them there in favor of mandatory mask at this time, other than Brookings. So, like I say, we meet twice a month. I haven't seen any of it. So, but as we've said before, it's a tool that's on the desk. We're not taking those tools off the desk. If it becomes overwhelming and there's a need and there's a public push for it, we'll certainly be looking at it as we did on Monday night.
I think the big thing is that we need to consider the fact that if things worsen and continue to worsen, we'll be skipping the mask and go to a shutdown.
That's right.
So step one, step two, we need to do everything we can do to avoid a shutdown.
I'm going to be a Huron cheerleader for a little bit and not apologize for it. We've got a theme that the kids started years ago chanting, "We are Huron," and I'm just going to be a cheerleader that we can fix this without a mandate if we can all be Huron, all care about our neighbors and get after it. You know, even in the Bible it says the children will lead us, and the kids have figured out, and I've had fun telling people this, that they can wear masks, learn and play and be with their friends, or they can not wear masks and be stuck with their parents. And the kids have absolutely bought into, we want to be kids. And if we'd let the kids lead us, and we'd get after it, and we'd do that same philosophy that we can wear our masks, our businesses can stay open, we can have our events in the arena, and we can rock, we can do this together. And if not, Dr. Bob just said it, then we go back to the dark days of April. And so I just believe in us. If we would just hunker down, I'm going to challenge men. One time a person asked me, why have you got a mask on at the gas station? I said, because if this 64-year-old man wears a mask, maybe the rest of the men will wear masks, and then we'll get everybody wearing masks. Because that's the key, is to call upon our peers to follow through on this. We could do this, people, and we could get it turned around.
And we're going to need leadership. We're going to need leadership at the national level and at the state level. Until we get those mandated down to do leadership and step up, it's still going to be a problem because it's so political right now, so many sides to it. We've got to get united with our leadership. No more.
No more.
No more questions or no more statements? Do we have anything more from the, oh, that's Bob's. Anything more from the task force tonight? I certainly appreciate everybody coming. We're going to look at doing this again. I don't know if we're going to do it weekly like we did back in April and May, but I think there's a call for us to get up in front of the public and let them know what's going on, where our feelings are at this time, because it does change from month to month. The more times we can, as Joe says, more times we can talk about masks and about washing our hands and social distancing, the better we're going to be. So with that, thank you for all. We appreciate it so much. We appreciate what you do every day. And That's why I try to work together and try to solve